What's going on, Steno peeps? Jen back with a brand new dictation. Today we're going to do a 7-minute Q&A based off of a lawsuit related to acupuncture. As always, I'll be speaking in a low voice for the attorney and a high voice for the doctor that's on the stand, who is Dr. Smith. So be sure to set your speed controller and let's get started. Dr. Smith, thank you for being here today. Can you please state your qualifications for the court? Certainly. I am a licensed medical doctor with a specialty in pain management. I've been practicing for 15 years and I'm also certified in acupuncture. Let's talk about acupuncture. In your expert opinion, is acupuncture considered a safe treatment? Generally, yes. Acupuncture is considered safe when performed by a properly trained and licensed practitioner. However, like any medical treatment, there are risks, especially if the procedure is done incorrectly. What are some of the risks? The most common risks are mild, such as bruising or soreness at the needle site. However, more serious complications can occur, such as infections, nerve damage, or punctured organs, though these are rare. Let's focus on punctured organs. Can you explain how that could happen during an acupuncture session? A punctured organ, most often the lung, can occur if the acupuncture needles are inserted too deeply or in an appropriate area. This is known as a pneumothorax, where air leaks into the space between the lung and the chest wall, causing the lung to collapse. In your review of the case, did you determine whether the plaintiff suffered a punctured lung during their acupuncture session? Yes. Based on the medical records and the plaintiff's symptoms, it appears the patient did suffer a pneumothorax, which is consistent with a punctured lung caused by improper needle insertion. Could this injury have been avoided? Absolutely. This type of injury is preventable if the practitioner follows proper protocols and has a solid understanding of anatomy, particularly in vulnerable areas like the chest. In your opinion, does the acupuncturist in this case appear to have followed proper safety protocols? From my review, it seems there were several deviations from standard practice. The depth of the needle insertion and the location chosen were risky given the plaintiff's body type and condition. How should a trained acupuncturist handle such situations to avoid this kind of injury? A trained acupuncturist should assess the patient's anatomy, avoid high-risk areas, and ensure the needles are not inserted too deeply, especially in areas near the lungs. So, in your expert opinion, would you say acupuncturist negligence likely led to the plaintiff's injury? Yes. Based on the evidence I've reviewed, I would say the practitioner's negligence played a direct role in the patient's injury. Thank you, Dr. Smith, for your testimony so far. Let's dive a bit deeper into the details of this case. You mentioned earlier that acupuncture is generally safe when performed by a trained practitioner. How much training is typically required to become licensed in acupuncture? To become a licensed acupuncturist in most states, individuals must complete a master's degree program in acupuncture or oriental medicine, which typically takes about 3 to 4 years. Additionally, they must pass certification exams and in some cases undergo clinical supervision. In your experience, do you believe this training is sufficient to prevent serious injuries such as the ones sustained by the plaintiff? Yes, the training is generally comprehensive enough to prevent injuries like this. Acupuncturists are educated on human anatomy, needle placement, depth, and safety precautions. That said, errors can occur, especially if the practitioner is not paying close attention or is inexperienced. I see. In this case, you mentioned earlier that the plaintiff suffered a pneumothorax or punctured lung. How quickly would a patient notice symptoms of this kind of injury? Symptoms of a pneumothorax can develop immediately after the injury occurs or within a few hours. The patient may experience sudden chest pain, shortness of breath, and difficulty breathing, which is exactly what the plaintiff reported in this case. And once these symptoms appear, what steps should be taken by the acupuncturist or any other health professional present? The acupuncturist should immediately stop the treatment and seek emergency medical care for the patient. A pneumothorax is a medical emergency, and the faster it is treated, the better the outcome for the patient. In this case, it was noted that the acupuncturist didn't immediately recognized the symptoms and suggested the plaintiff go home and rest. Is that consistent with the standard of care? No, it is not. If an acupuncturist notices symptoms like difficulty breathing or chest pain, they should never suggest rest as a remedy. Immediate action, such as contacting emergency services, is required to prevent worsening of the condition. All right, that's a wrap on this Q&A. I'm going to be doing a lot more Q&A because I know for me personally, this is the most challenging dictation to do. And I think that's kind of the consensus across the board. So be on the lookout for more Q&A. Be sure to subscribe so you don't miss any of those dictations, and I'll catch you on the next one.